Hello viewers, today's topic is on learning disabilities. The objective of studying this lesson is to impart knowledge on the basic issues concerning learning disabilities, that includes the facts, prevalence, causes, symptoms. The second main objective is to impart knowledge about the assessment procedure for early identification for planning remedial strategies for children with learning disabilities. The way our brains process information is extremely complex. It is no wonder that sometimes the things get messed up. For example, take the simple act of looking at a picture. Our brains not only have to form lines into image, they also have to recognize what the image stands for and relate that image to other facts stored in our memories, and then store this new information. A learning disability is a neurological condition that interferes with a person's ability to store, process or produce information. Now, we will try to understand what actually the learning disability means. Learning disability can affect one's ability to read, write, speak, spell, and also affect a person's attention, memory, coordination, social skills and emotional maturity. Now, we will try to understand clearly the concept of learning disability. Learning disability can be defined as a neurological dysfunction which interferes the brain's capacity to process information in a conventional manner. The children with specific learning disabilities exhibit a disorder in one or more psychological process involved in understanding or using spoken or written language. Learning disability is manageable but not curable. Children with learning disability may have very high IQ, but the problem is that both left and right part of the brain work simultaneously. This leads to confusion regarding accepting a situation. With right diagnosis, instruction, hard work and support, individuals who are dyslexic can succeed in school. Professionals, parents and others involved in this field should continue to invest efforts to seek more knowledge about the nature and intervention of learning disabilities for enhancing the academic success of the children. After having some idea or a concept clarification, now let us see the prevalence or the magnitude of this problem in India. Approximately 10% of the total population are estimated to have learning problems, out of which 4.6% of the school-aged students are identified as severely learning disabled. It is assumed that learning disability is more prevalent among the boys than the girls in the ratio of 4:1. There is no statistics available regarding this prevalence in India, and there is no exact data on the number of children requiring support in education in India because most of them are accepted in general schools. The special needs of these children are not met in the classrooms because the class teacher does not possess the competences for it. And the time available with meeting individual needs is also very limited. These children do not require exclusive arrangements for special education. Such children with low level of functioning requires supportive education which can be provided through resources, room facility in the existing school itself. An important requirement in the diagnosis of learning disability is the discrepancy between one's ability to perform and their actual performance. There is no sign to tell that a person is having a learning disability. Now, let us look into the characteristics that may be apparently present in a learning disabled child. We find a difference existing between the child's ability and his actual academic performance across one or all the skill areas. Academic learning difficulty. The problem exists in the areas of reading, writing, spelling and mathematics. Perceptual disorders. The problem includes inability to recognize, discriminate and interpret sensation. It can be in the area of auditory or visual channel. Metacognitive deficits. This involves the ability to use self-regulatory mechanisms such as planning moves, checking the outcome and remediation of errors. Motor disorders. The children with this problem are clumsy. They exhibit fine motor difficulties, that is having sloppy handwriting, that is difficult to read or holding a pencil in a very awkward position. Difficulty with non-literal or figurative language such as metaphors, idioms and sarcasm. They have difficulty with verbal memory and processing large amount of spoken language. They have visual spatial deficits and ineffective use of visual imagery. Cognitive deficits. Problems with abstract reasoning, impulsive decisions and judgment. Attention problems. These children may be hyperactive, distractible or passivity. When a child has a learning disability, she has the following problems. They have trouble learning the alphabet, rhyming words or connecting the letters to their sounds. They may have trouble with the spelling. They face problem with the handwriting. They may struggle to express their ideas in writing. They may learn the language late and have a very limited vocabulary. They may have trouble remembering the sounds the letters make or hearing slight differences between the words. They have a trouble while understanding the jokes cracked by their fellow students. They have trouble following directions. They mispronounce the words or use wrong words that sound similar. They may not follow the social rules of conversation like taking turns or may stand very close to the listener to understand what he or she is speaking about. They have a lot of confusion with the math symbols and always misread the numbers. These are some of the characteristics and problems a learning disabled children might face. After having an understanding of the concept and its prevalence and knowing about the symptoms of a learning disabled child, let's move on to the different types of learning disability. The first learning disability can be classified as information processing deficit. Information processing deficit has again 4 classifications, that is input deficits, integration deficits, storage deficits and output deficits. Let's now know about the input deficit, which is also known as problem with collecting information. This is the information perceived through the senses. This includes auditory perception disorder and visual perception disorder. Auditory processing disorder describes a variety of disorders that affects the way the brain processes or interprets what it hears, even though the student might have adequate learning. The student with auditory processing disorder has the following difficulties. They have a trouble with listening, particularly when there is a background noise or when the child's attention is divided. The second difficulty is processing information if the speaker is speaking quickly. Visual processing disorder. A visual perception disorder involves difficulty in making the senses of what is seen even though the vision is intact. A student with visual processing disorder has trouble with recalling and using visual information. For example, remembering the order or meaning of symbols, words or pictures. And they have trouble differentiating the colors, letters or numbers that are similar. Integration deficit disorder. This stage, during which the perceived input is interpreted, categorized and placed in a sequence or related to previous learning. A student with sensory integration disorder may have trouble with extremely over or under reactive to senses like the touch, sound, light, smell or anything that is put into their mouth. They have very strong over or under responsiveness to movements. They have a very strong attraction or they may dislike or for getting messy. They also have problem to know how much physical pressure they have to apply to something. These are some of the problems faced by integration deficit disordered children. Now, have a look into the storage memory deficits. Problems with memory can occur with short-term memory or working memory or with long-term memory. Most memory difficulties occur in areas of short-term memory, which can make it difficult to learn new material without many more repetitions than is usual. The last one is the output deficit or expressing information disorder. Information that comes out of the brain either through the words, that is the language output, or through muscle activities, that is the motor such as gesturing, writing or drawing. Difficulties with the language output can create problems with spoken English. For example, answering a question on demand, which one must retrieve information from the storage, organize one's thoughts and then put these thoughts into words before we speak. The next classification is the forms of learning disabilities, which includes visual perception disabilities, auditory perception disabilities, sequencing disabilities and the abstraction disabilities. Visual perception disabilities. The children with difficulty have a problem like reversing the letters. S for E, E for 3. They reverse the words like verse for saw. Auditory perception disabilities. Some children have difficulty distinguishing slight differences in the sounds. The child might appear means understand what the others are saying and thus respond very incorrectly. Sequencing disabilities. The child has difficulty telling or writing a story. The sequence of thoughts or events are all mixed up. Abstraction disability. A child with this disability will have difficulty knowing the meaning to words or phrases. The child may have difficulty, for example, like between the words dog and yours dog. He cannot relate to the words of your dog. Then, after this, we find to see the specific learning disabilities. The specific learning disabilities include the reading disorder, the writing disorder, dyscalculia or arithmetic disorder, and spelling disorder. Reading disorder or dyslexia. It is generally characterized by the difficulties with the alphabet, with recognition, decoding, spelling and comprehension. A student with a reading disorder or dyslexia has the following problems. He has a trouble naming and learning the sequence of a printed alphabet, reading the words that cannot be translated into a mental picture, reading aloud the material without mistakes and pauses. Writing disorder or dysgraphia. It is generally characterized by distorted writing in spite of thorough instruction. A student with disorder might experience some of the following difficulties: inconsistent and sometimes illegible writing. For example, mixing up the print, mixing up the uppercase and lowercase while writing in a cursive handwriting, irregular sizes and shapes of the letters and slant of the letters. They have inconsistent positioning of the page with respect to the lines and margins. They also have unfinished words or letters, omitted words, and many spelling mistakes. They have inconsistent speed in writing, either extremely labored or very quick writing. These are some of the problems faced by writing disordered children. Spelling disorder. Spelling disorder is also known as dysorthographia. It is generally characterized by difficulties with the spellings. They stem from weakness of the memory of language structure and letters in the words. A student with spelling disorder presents some of the following difficulties. Arbitrary misspellings such as addition, omission, or substitution of letters in the word. Reversal of vowels or other syllables. They show very slow, hesitant, and poor written expression. They find errors in conjugation and grammar, phonetic spelling of non-phonetic words, and they have misunderstanding the correspondence between the words, sounds, and letters. The last but not least is the dyscalculia, which is the arithmetic disorder. It is generally characterized by difficulty in learning and comprehending mathematics. It affects the person's ability to understand and manipulate the numbers. A student with arithmetic disorder or dyscalculia faces the following problems. Organizing the problems on the page and keeping the numbers lined up is difficult for them. They have a trouble following the multi-step calculations, for example, long divisions. They have the problem transposing numbers accurately onto the paper or onto the calculator. They always turn, for example, the number 56 to 65. And they have a trouble distinguishing right from left. They have a problem using the mathematical calculation signs, and they confuse on the basic operations and the facts applying logical calculations. These are some of the problems faced by a dyscalculia person or arithmetic disordered child. After classifying the learning disabilities, let's now move on to the causes of learning disability. What can be the causes of the learning disability? There are three general categories of causation of learning disability. They are the heredity, problem during the pregnancy and at the time of birth, and incidents after the birth. Now let's see the factors due to heredity. Heredity means the genetic factors. Heredity aspects of LD, that is learning disability, so often runs in the family. It is not uncommon to find people with learning disability have parents, children, and other relatives with the similar difficulties. Now we'll see what are the problems during the pregnancy and at the time of birth that can lead to learning disability. Injury or illness during or before birth, tobacco using during the pregnancy, alcohol using during the pregnancy, fetal alcohol syndrome, a condition that can lead to low birth weight and intellectual impairment, hyperactivity, and physical defects. All these lead to learning disability in the child. Incidents after the birth. Head injuries due to accidents can lead to learning disability of a normal child. Poor nutrition or diet can lead to abnormal development of the brain, which causes learning disabilities of the child. Exposure to toxic substances like lead or cadmium can also lead to the problem of learning disability. Cancer treatment with the chemotherapy or radiation at an early stage, especially to the skull, can lead to learning disability of the child. These are some of the causes of learning disability occurring in the child. After having understood the causes, now let us see how a learning disabled child can be assessed. Now, we will see what are the common tests that can be administered to a child to know whether he is learning disabled or not. Beigency Diagnostic Inventory. It is a test which measures the visual discrimination, auditory discrimination, fine motor skills, verbal fluency, memory attention and handedness. The next test is Bayley Scale of Infant Development. It tests to administer to find out the delays in development. The next one is the Wessler's Preschool Primary Scale of Intelligence. This test is most frequently used to identify a learning disabled child because it involves reading and writing. The next one is a developmental and social history. This is usually given to the parents and guardians, where narrative questions are asked to provide important facts about the child development. Behavioral observation. It helps to identify factors in the classroom environment affecting the child's learning ability. Achievement test. These tests are administered to determine the child's current skill levels in academic skills. Adaptive Behavior Scale. This test assesses the child's ability to perform a task necessary to maintain self-care and interact socially appropriate with the children and others at home and school. Reading Assessment Test. It helps to assess the reading age and reading disabilities of a learning disabled child. Arithmetic Skill Test. This test helps us to know the nature of problem in mathematical operation. These are some of the tests that can be administered to a learning disabled child to know where the problem really lies, so as to help the child improve his academic skills. Ways of helping a visual perception disabled child. Like, what are the strategies we can use to help the child with learning disability because of visual perception disorders? Encourage the child to use a book stand to hold the books and papers upright to reduce the glare on the pages when reading and copying. Give the child extra time to complete visual perceptual activities. Avoid the tasks like copying from the blackboard or from the books. We can ask a classmate to prepare a notes or a carbon copy for the learning disabled child instead of the child herself or himself taking down the notes from the blackboard. The child can also use tape recorded class lectures instead of having to write or copy from the blackboard. Using large print books, workbooks and large sheets can help the child with visual perception disabilities. Another important and interesting way to help these disordered children is providing a rich tactile experience. For example, using sandpaper letters or forming letters using a play dough or glue, or outlining the letters with glue, let it dry and then they can feel much better. This way it helps the child to learn very easily and retain what has been learned. You can mark the child's desk with right and left markers. These are some of the ways of helping visual perception disordered child. Now let us move on to the ways to help auditory perceptual disordered child. Give the child extra time to think about a problem or answer before requiring a verbal response from him or her. If the visual skills are strong, use the sight words, for example, look and say, and similar other techniques for reading. Do not give directions to the child in the mid-task of performing a task. Wait until he has his full attention on you. Provide the child with lots of visual reinforcement like the pictures, maps, charts and graphs. They help to keep up the child's attention. While you are teaching a new concept, illustrate the concept when giving verbal expression. This really helps the child with auditory processing disorder. Ways helping the child with memory deficits. You may need to repeat the directions step by step and then have the child repeat them and demonstrate of what he or she knows. Review the materials previously learned as often as possible until the responses become automatic. Ways of helping the child with language disabilities. Role play situations involving social conversation and demand language. Give the child extra time to respond to questions, particularly during the test. Ways to help the child with fine motor disorders and writing difficulties. You can help the child by avoiding the assigning giving for copying or written assignments. Use manipulative activities to increase the fine motor control. Chalkboard practice can really help these children. Now, we will see the ways to help the child with spelling problems. These children can be asked to read and spell together, given a context of language and meaningful practices. You can discuss the word structure, their origin and meaning of the words. Encourage the child to have a hands-on practice with spellings by providing a tray of salt or modeling clay to make words, printing the spelling word on a strip of paper, cutting these letters and asking the student to rearrange these letters according to the word. These are some of the useful ways to help different types of learning disordered children. A learning disability cannot be cured or fixed. It is a lifelong issue. If you find a child with a learning disability, don't get frantic. Number of people like the Walt Disney, Alexander Graham Bell, Churchill are all learning disabled people. Learning disability does not interfere with the IQ of the child. Only the thing you can do is encouraging their strength and knowing their weakness, understanding the educational system, working with the professionals and learning about the remedial strategies to teach these children. Most importantly, if you suspect a child with learning problem, do not delay in seeking help. Take action immediately. Hope you have understood and enjoyed this learning on learning disabilities. Thank you.